Imagine you wake up with blurry vision. Your doctor refers you to a specialist, but your insurance blocks the referral.
Call me to defend why you think this patient needs this.
That causes you to go blind.
This does not appear to be a random act of violence.
Imagine you have multiple sclerosis. Without warning, your insurance stops your medications.
No, you cannot give this drug.
So you become paralyzed.
The victim was in New York City to speak at an investor conference. It appears the suspect was lying in wait for several minutes.
Imagine your father has cancer. His doctor orders an MRI.
No, you cannot order this imaging.
Prescribes chemotherapy.
Have you considered this other, less expensive option?
His insurance causes delay after delay.
No, you don't need this surgery.
He dies.
And as the victim was walking to the conference hotel, the suspect approached from behind and fired several rounds, striking the victim at least once in the back and at least once in the right calf.
Prior authorization. Here's how it works. Before your doctor provides a treatment, your insurance requires them to prove it's necessary. This is often a time-consuming process that can cause dangerous delays.
I'm sorry, your cancer could be cured, but we need to wait for the insurance company to approve your chemotherapy.
That's Dr. Jane. She's barricaded by prior authorizations daily.
This is a really big issue, and it impacts every single person in this country who has insurance.
Insurance companies say that this process helps reduce the cost of expensive treatments, ensure safety, and lower the total cost of care. But what it's actually doing is creating a lot of expensive bureaucracy.
We have 4 full-time employees who their sole focus is on obtaining prior authorization for medications to treat Crohn's disease and ulcerative colitis. And that's just for one disease state.
By one estimate, the U.S. spends about $35 billion a year on the administrative costs of prior authorization.
These resources could be devoted to patient care, answering phones in a timely fashion. I might actually get to go home and see my family on a regular basis.
In an admission of sorts, some companies have actually pledged to reduce prior authorizations, but those efforts only scratch the surface.
I am a board-certified gastroenterologist. I know what I'm doing, only to be blockaded by all of this bureaucracy, red tape, which really only serves to enrich the insurance companies.
Cigna made $5.2 billion in profit last year. Elevance made $6 billion. United Healthcare made $22 billion.
I had a patient who had a new diagnosis of lymphoma, and the insurance company was giving us a hard time to give the chemotherapy. I got someone on the phone, and I told the person, I said, I need your name, because when this young man dies, I want to tell his parents who was the reason behind it. I went home and I cried after I hung up the phone because I was so emotionally exhausted. And that was just one patient. I had seen 25 other patients that day, and many of them would eventually need prior authorizations as well.
When it comes to denying claims, multiple reports suggest that UHC, which is the country's largest health insurer and serves some 50 million people, is an industry leader, with a rate nearly double the industry average. A recent Senate report slammed the company for denying nursing care to patients recovering from falls and strokes on its Medicare Advantage plans. And it currently faces a class action lawsuit for its use of AI algorithms to automatically refuse payment. The insurance giant's tactics have frustrated patients and healthcare providers alike. A major protest at the company's subsidiary Optum's headquarters in Minnesota in July attracted roughly 50 demonstrators, 11 of whom were arrested. Disputes with hospital systems over UHC's claim denials have led to some deciding not to accept its insurance at all. Insurance insights firm Value Penguin told Forbes that gauging an exact number of claim denials is tricky, as there's no central repository of this data. But according to one of the firm's reports on insurance claim denial rates, UHC has the highest instance of denials out of all major providers, refusing an estimated 1/3 of claims submitted. The insurer did not respond to a comment request. United Healthcare also has the largest market share of health insurance policies, with roughly $215 billion in revenue. Value Penguin said that based on current insurance plan costs, UHC offers the most expensive premiums in the nation compared to other providers. For example, a middle-tier plan with UHC would cost a 40-year-old person $631 per month, whereas the national average would amount to an estimated $621 per month. The shooting has reignited a national conversation about America's for-profit healthcare sector and many people's inability to afford treatments and medication. Healthcare.gov issuers denied a total of 17% of claims in 2021, with some issuers' denial rates reaching 49%, according to a 2023 report by health researcher KFF. In a 2023 survey of consumers' experience with their health coverage, KFF found that nearly half of adults who had insurance problems were unable to satisfactorily resolve them, with 15% saying they experienced a decline in their health and 28% saying they paid more than they expected. United Healthcare announced a new policy, effective December 1st, by which it may deny charges for inpatient or outpatient services that it considers, quote, routine, which would give the insurer more opportunity to issue denials around specific line items, according to healthcare attorneys at Davis Wright Tremaine. The UHC CEO was shot and killed as he was on his way to a Manhattan investor meeting for parent company United Health Group around 6:45 a.m. last Wednesday. In the hours after, anger and frustration over insurance denials and medical costs bubbled up online and in conversations. One angry poster wrote on X, formerly Twitter, quote, "When you shoot one man in the street, it's murder. When you kill thousands by taking away their ability to get treatment, you're an entrepreneur."
And Bryn, you have been diving into the suspect's background. What have you learned about him?
Yeah, Aaron, this was no career criminal. As we've been learning from law enforcement, there were no prior arrests of him. He wasn't really on their radar. And for what we've learned is that Mangione really went to some of the best schools in this country, comes from a prominent family in Maryland. As far as those schools, we know he graduated in 2016 from Gilman High School, which is an all-boys school. He was valedictorian of his class where he gave his speech at his graduation. Then he went on to the University of Pennsylvania, where he also graduated with a bachelor's and master's degree, computer science as well as mathematics. Extremely smart, told his newspaper there that he wanted to learn how to code because he wanted to make his own video games. Extremely smart individual. As far as the family is concerned, we know that his grandfather was a real estate mogul in that area in Maryland, and that his family owns a bunch of nursing homes. They also own a bunch of country clubs. So really interesting pieces making up the framework of who Luigi Mangione is.
The story broke. United Healthcare is the largest private health insurance payer in the United States, and they've been widely criticized for their frequent denials of healthcare claims. In fact, they're reportedly the worst offenders when it comes to denying in-network claims. Their denial rate this year is a whopping 32% compared to the industry average of 16%. Between 2019 and 2022, United Health's post-acute services denial rate increased from 8.7% to 22.7%, the report found. Meanwhile, United Health's skilled nursing home denial rate increased ninefold. Meanwhile, they have been raking it in. United Health ranks as the nation's fourth largest company by revenue this year, just behind Apple and ahead of tech giants Alphabet and Microsoft. Last year, they brought in $376.6 billion in revenue and reported $22 billion in profits.
You have to separate out two different things. One is, was this attack justified in any way good? And the answer to that is obvious. No, vigilante justice is never the right answer. Violence is never the right answer. Assassinations are never the right answer. Now the second part of the question, the topic is why? And that's a very legitimate question. We ask that anytime there's any kind of shootings, mass shootings, etc. And so the reason we ask why is not to justify it, but to learn from it so that we can prevent it going forward. And so the why here is, to me, enormously obvious. We live under corporate rule, and the corporate rule is squeezing, in this case with health insurance and drug companies, et cetera, literally squeezing the life out of us, right? So the press will make a giant deal out of this story, and I get why, and it's understandable. But it's of course because someone powerful and wealthy died, and they shouldn't, and that's terrible. And your heart should go out to them. And he's got a family, etc. But no one ever notices the 76,000 people dying every year because we don't have universal health insurance in this country.
I'm opposed to abortion. But I do not believe that just because you're opposed to abortion that makes you pro-life. In fact, I think in many cases your morality is deeply lacking. If all you want is a child born, but not a child fed, not a child educated, not a child housed, and why would I think that you don't? Because you don't want any tax money to go there. That's not pro-life, that's pro-birth. We need a much broader conversation on what the morality of pro-life is.